And welcome to our Farm to Home segment with Thomas McDowell, registered pharmacist with Rocky Mount Medical Park Pharmacy. Hey, Thomas.
Hey, Sandra. Thank you.
So glad to have you
Glad to be
here
here
today. And the topic is wonderful. This is National Diabetes Month. We're talking about diabetes on our health show and also on this segment this morning. So I'm pleased that we're doing that. Diabetes nutrition is something that we really need to educate about.
Absolutely. So we're going to focus more on the nutrition end of things, which in my opinion is arguably the most important factor when it comes to preventing diabetes and supporting diabetes if you've already been diagnosed, and trying to maintain a healthy lifestyle because type 2 diabetes is preventable. So we'll touch a little bit on the background of diabetes in general. And so if you didn't know, there are two types of diabetes. There's type 1, which is an autoimmune disorder, and we really don't know how or if you can prevent it. So usually there's childhood onset. That is not reversible, and it's not really something that you can prevent or that we know how to prevent. Those patients are completely insulin dependent. They do not produce any insulin. But this nutritional discussion still applies there because they do need to very closely watch their diet,
right,
because they are not producing insulin. So when they intake carbs and sugar, it can, of course, raise their blood sugar. And so really we're going to focus more on type 2 diabetes, which is the one that usually is a later onset in life. But I've seen patients that are young, that are in their late teens and 20s, that have type 2 diabetes. And that's almost always a dietary and lifestyle issue. Sedentary lifestyle plus a poor diet that's heavy in carbs and processed sugar is typically what causes type 2 diabetes. There are some genetic predispositions that may put you at a higher risk, family history and certain ethnicities, but still it can be prevented with the proper diet and lifestyle most of the time. So real quick, we'll run through some signs and symptoms of diabetes. So the one that really stands out that most people might notice is that if your blood sugar is elevated, especially for a fairly long period of time, you may find that you're having to go to the bathroom more often. You're urinating more often. And what's happening there is your body's trying to get rid of excess sugar through the urine. And so it's a compensatory mechanism where your body's saying, there's too much sugar in my blood, I need to get rid of it. And so it tries to pull it out through the urine. That also leads to you being very thirsty, feeling dehydrated because you're getting rid of a lot of urine.
Exactly.
And so, you might be very thirsty, lose weight without trying, hungry, blurry vision because it can affect, elevated sugar can affect your vision, numb or tingling hands. Elevated blood sugar can damage your nerves and circulatory system. So in your extremities, especially your feet and sometimes your hands, you may feel some numbness, tingling. If you're feeling that, your blood sugar's probably been elevated.
And it can lead down the road to neuropathy, right?
Yeah, and even amputations.
Which is not good.
Yep, and we have a lot of patients that take medications for nerve pain because once those nerves are damaged, it's sometimes irreparable. It's something you can live with, but it can be painful and frustrating to have the numbness and tingling and even burning in your hands and feet. And if you really ignore the signs and symptoms and have unmanaged diabetes for months and years, it can damage your circulation so much that you may even have to have an amputation or lose a foot or a toe, or because your body can't fight off potential infections. We need blood circulating throughout the body. So those are some signs and symptoms, some complications, just so you know what can happen if you don't manage your diabetes, or if you end up being diagnosed with diabetes: heart attacks, strokes, kidney damage, blindness, dental issues. So a lot of organs are affected by having diabetes. And what diabetes is elevated blood sugar. I didn't mention that, but if your blood sugar is over a certain level, then you would be diagnosed as diabetic.
What would you say is what would start to be high?
Yeah, great question. So if you're hovering over 100 fasting,
Okay.
you're creeping up there. You might still
Okay.
be in they call it pre-diabetic stage, but really it's just almost like a precursor, or kind of low level diabetes. But so we're looking normal is under 100, 70 to 90 for somebody that's not diabetic, and that's fasting. So if you're checking first thing in the morning, right when you wake up,
Right.
and so if it's after eating, there's a little more leeway. But if you're like over 180,
Right.
then you're a little bit high. And so what they'll do if you go to the doctor is, of course, they can check a blood sugar immediately and tell you what your number is.
Right.
That's not usually the way that they like to diagnose diabetes. They'll take a number that's called an A1C. If you've ever heard your doctor mention an A1C, that reflects the past several months of your blood sugars. It's almost kind of shows a picture and an average of where you were at for the past few months. And so that number, if you are 5.7 to 6.5, you're considered pre-diabetic, and if you're over 6.5, you're considered diabetic. And so that's a number to keep an eye on. If it's creeping up every year, even if you're below the 5.7, you might want to look at your diet and lifestyle.
Well, that's the time to do something about it, not after you get it.
Exactly. And in healthcare, at times we don't focus quite as much on the preventative because there's just not much time with your provider, and they're so busy that they're trying to manage what you're coming to them for right there at that moment. Maybe it's your blood pressure or your high cholesterol, but there might not be as much focus or time to talk about that A1C that's creeping up, that's maybe not diabetic yet, but if you're trending that way, you might get there.
Yeah,
and,
exactly.
It could be avoided, and people are thinking, well, I don't have any issues, my blood sugar's fine. But what happens is your body compensates and produces more insulin when you're taking in a lot of carbs and you have a sedentary lifestyle, and it is working overtime for long. And then at a certain point, it doesn't completely give up, but it kind of peters out a little bit.
Yeah.
And it doesn't produce as much insulin. Your pancreas doesn't produce as much insulin.
And you're talking about a sedentary lifestyle. Explain to people what that is.
So a lack of physical activity and movement.
Walking is a really good thing if you're diabetic, walking is good, period.
Moving,
if
period.
you don't, I hear people say all the time, I hate exercising, and I will admit I'm one of them. I hate exercise, but I like walking. So if you don't like exercise,
any movement is better than no movement, and so start somewhere. Walk one time a week. Walk, then 2 times, then 3 times, then maybe a fast-paced walk.
Yes.
And if you can, do a little jogging, use the elliptical, the treadmill. You'd like to get your heart rate up a little bit.
Yes.
But any movement is better than none.
And if you have a desk job, get up every few, hour, 30 minutes, hour, whatever. Walk around, do something.
On your lunch break, we see a lot of folks,
Yeah.
that are outside walking. It's getting to be a little colder, so that's a little tougher. But that's a great time to try to fit it into your work day, and or at the end of the day. But get out there and start moving, because if you're not eating well and then you're sedentary, your body really doesn't have anything to do with those carbs.
Right.
We need carbs for energy if you require energy, but if we're not moving, then your body doesn't know what to do with that those carbs that you're intaking. And so the prevalence of diabetes has increased greatly over the past 20 years. It's about 10-12% of the population has diabetes now. And that's, I think, as far as in 2019, it was about 37 million Americans had diabetes, and a lot of those were undiagnosed. So diving into the diet, we're looking at carbs mostly is what we're focused on. So that's they're in sodas, they're in pasta.
Sodas has got to be one of the worst.
Yeah.
You're just drinking sugar.
Yeah, and
That's what you're doing.
So they're one of the easiest ones, in my opinion, to cut out, because they're not adding any nutritional value, and diet drinks are out there and available.
Yes.
And they taste.
They put
pretty
weight
good.
on you. I mean, everybody that drinks diet drinks tell me that two of my friends stopped drinking diet drinks and went to water and other things, and you wouldn't believe the weight they lost.
Yeah, water's the best, but if you have to have something and you're watching your carbs, you can go diet. Be careful with fruits and sweet tea. A lot of sugar there, but we're talking about starches, grains, milk and yogurt, fruits, sweets, candy. They all have carbs. So start looking at your labels. A low carb diet is typically less than 150 grams of carbs a day. And if you drink 2 Coca-Colas, 20 ounces, you're at about 140 grams. So that you've already hit your limit, so to speak. So when we're talking about foods that don't have carbs in them, vegetables, meats, and fats and oils.
Yes.
It's not a ton of foods, but and it's not about cutting out all carbs. It's about moderation.
Right. Exactly.
And so the plate method is what we look at when we're trying to build a balanced meal if you're diabetic. So half of your plate is fruits and veggies, a quarter is protein, so your meats, and then another quarter is your grains, which has some carbs, but it's a small amount.
Yeah.
It's not a huge whopping plate of pasta, and then maybe a little dairy mixed in there too. So it's all about moderation. You do need some carbs for energy.
Yes.
So I don't always recommend an aggressive keto diet.
Yes.
Although it works for some people and it does help you lose weight, but sometimes it can be dangerous if you're too aggressive, too fast. If you're going from a lot of carbs to keto, your body is not going to adjust well. So having a moderate amount of carbs is key. And so, looking at your serving sizes and your portions is really important, but just the easiest way to start doing something is to just build a balanced plate and exercise and just start looking at your labels. And if you're exercising, look at the amount of calories that you burn when you exercise, and then look at the amount of calories in a Snickers bar.
Yes.
And it'll really put it into perspective how long you have to exercise to burn that candy bar off. So it's all about awareness and information, education, and so nobody wants to have to inject themselves with insulin if they can avoid it, and deal with the complications of diabetes. So it is preventable for most patients, especially type 2. Talk to your pharmacist about it. Talk to your provider. Be proactive about it. Start thinking about it before it's time to start having to make a ton of lifestyle changes all at one time, which can be really hard.
And your pharmacist can advise you on good eating habits for diabetes. I mean, you can't, we talk about this all the time. We're not beating up the doctors. We're just stating the fact that it is, and the doctors will tell you this, it is easier to get in. Accessibility to your pharmacist is a whole lot easier than getting into your doctor.
You can walk in and see us or call us and get us pretty easily, and doctors are super busy, ton of appointments all day. And so come and talk to us if you're wondering how you can start changing your lifestyle. We'd love to help you and be a part of that journey. And there's supplements that you can also take that can help support your diabetes. And we can talk to you about your medications, your side effects, and while we're on that subject, it's really important for diabetic patients to make sure they're looking at the vaccines that are available, because they might be more susceptible to some complications from certain viruses and diseases. So, we're in the thick of flu season, so we have flu shots at Medical Park Pharmacy for the high dose for seniors and the regular one. We have the RSV vaccine, which is a new vaccine. It's for respiratory syncytial virus, which is a seasonal respiratory virus similar to the flu. There's never been a vaccine for that. So that's for 60 and up. There's the pneumonia shot that's for 65 and up. And, of course, shingles all year round is a good one to look at. And we do have the new COVID formulation that covers some of the newer strains if that is something that you're interested in. We'd love to help you and serve you. And call us at 443-7979 at Medical Park Pharmacy. We're at 901 North Winstead Avenue, Suite 100 in the Medical Park Building, or Boyce Willis Clinic, as it's often referred to.
Yes.
So we'd love to be there for you.
Well, go get your, and now, do they need to make an appointment?
No appointment, so walk-ins. And we're one of the only places that you can do that in the area.
Well, a box drugstore, now this is a fact, somebody told me yesterday, a box drugstore in town, a person walked in to get their shot, and they said, "No, ma'am, you've got to make an appointment." She said, "I've never had to make an appointment." She is leaving that drugstore because she said, "That's ridiculous." So you can go to Medical Park Pharmacy, walk in, get your shot. You do not have to have an appointment. Just saying, this is just something I heard yesterday from a box pharmacy.
Yeah, that's true. We've heard that time and time again, and it's especially for seniors that maybe aren't able or don't want to navigate trying to set up an appointment online. We can get you in and out in 15 minutes. We're the self-proclaimed best shot givers in town, so we're pain-free.
Another reason.
Yeah. So we'll get you in and out. It'll be a good experience, and we'll keep you protected and safe this winter season. So come and see us.
Very good. Okay, Thomas, thank you for being with us today and this wonderful information, and we'll see you back in 2 weeks.
All right. Thanks, Andrew.
We'll be right back with you with Roger and myself right after this.